At Making Medicine, we're reporting on the headlines, not making medical recommendations. For personal health questions, always consult a doctor. Nothing in this episode constitutes investment, financial, or legal advice, and please consult your own advisors before making decisions.
Firm, man.
Yeah.
Between two firms?
Yeah. For those who follow Incubate, you know the Epic Act. This is one of our champions.
That's seriously geeky, by the way.
I know. This is who you're talking
You got
to.
like T-shirts and stuff? That's okay. I did say IP was sexy. I'm with you. I'd like to get a T-shirt.
IP is sexy in quotes with the logo. We can do that. Welcome back to the Making Medicine podcast, where science, policy, and innovation meet. We'll be focusing on that middle word, policy, as for the first time ever, Incubate hosts a sitting U.S. Senator on the Making Medicine podcast. Senator Thom Tillis of North Carolina will be joining us to talk all things policy, all things politics, and of course, all things life sciences. As always, I'm your host, John Stanford. Let's get into the show. Senator Tillis, thanks for being on the show.
Thanks for having me.
I want to get started dialing back a few years. You've had a pretty incredible career, but it's not just U.S. Senate. There was a great time in North Carolina where you were in charge, and a steady stream throughout all of that was a commitment to life sciences. I mean, we did some digging and looked back at your leadership in the General Assembly. Obviously, on Capitol Hill, you've been a champion for life sciences. Where's that come from?
It really came from my focus on life sciences. Really did come from my time in the legislature. I was in the minority for 2 terms, 4 years, and then when we got a majority, I became speaker. And what I'd observed for 4 years, North Carolina, aside from having horrible tax and regulatory policy, they had an all of the above for economic development in the state. They didn't think about picking strategic sectors and doubling down on the ones that we had the most compelling case for. And so I said, guys, I don't want to be all things to all people. I don't want to pursue every economic development opportunity. I want to pursue ones where I could walk into a boardroom and say, you'd be crazy not to pick North Carolina. That sort of posture. So it's high tech, financial services, biotech, and military and defense related sectors were clearly our strategic sectors. I said, bet on them. Let's start encouraging local governments and local economic developers to build inventory for these types of projects. And I think the proof's in the pudding. Well, and incidentally, with due respect to the people who came up with the research triangle concept, back in the day, decades ago, everybody thought they were crazy. But I saw that as an asset that needed to be exploited, and that's why we went to targeted economic development.
Well, that we'll be coming back to that strategic, not just at the state level, but globally. What the U.S. does very well is biotech, and how do we keep that going? Let's talk about some of the fruits of your labor. I had the team pull the data. To date, 500 million, 600 million of new investments this year in North Carolina generates 220,000 jobs a year. The pharma and biotech in the state.
And those are direct jobs.
I mean, so where you know these numbers better than I do. It is hard to say. I mean, Massachusetts, California, they get to make big claims, big economies. North Carolina would not have been that third state, not be, I think we're CNBC's first state. I get asked a lot by other states, how do we catch up to North Carolina? What would you answer that question with?
Go back and implement a well-rounded tax policy. Commit to future reductions if you achieve growth standards for any kind of tax reform, regulatory reform you're after. It's pretty simple. Keep it simple. Understand that regulatory burdens are actually even greater than tax burdens. So take out any of the regulatory overhead that you can and focus on basis point differences between states. So when I came in as speaker, I said, guys, I don't want to be 2 percentage points better than South Carolina on taxes. I want to be basis points better. And if we can go further, great. But let's just manage so that we're always in the top 3, 4, or 5 on any major measure, and then we win on the merits of the state as a whole. That's how you win economic development.
And in your view, that delta is that small. I mean, you don't have to be 50 times better. In business, you just have to be a little bit better to attract the jobs and the investment.
It's a game of inches, and it's more sustainable. I think a lot of the states, when we decided to do tax reform, we were the first state, and it was something that I suggested. everybody was worried, well, what if we do these big tax cuts and the revenue doesn't come in? I said, let's adjust for it in the implementation. Let's create triggers. We'll do prospective tax cuts if we hit our clip rate. And we did every time. Every one of those triggers, when they came about, triggered another tax reduction. And so getting our tax climate to competitive at the same time that we're getting our regulatory climate to competitive. I think the other thing, now everybody wants to eliminate the income tax. I want you want to continue to have downward trend on income tax. But if you want a diversified tax base and you want something that can deal with counter-cyclical, be resilient, then you want primarily consumption-based taxes, but with some production-based taxes as a mix. And we've got the right mix. In several states, I was talking to the governor of Mississippi a couple of weeks ago, and he said, yeah, we're implementing tax reform, and we learned a lot from North Carolina and how to do it right, because we looked at all the states that did it wrong, had to go back and repeal taxes, those sorts of things. We haven't had to do that. And that's just being smart business-like in the approach.
And one, maybe I'm putting words in your mouth here, so push back if I am, but it's not the extremes. It's not no income tax. It is finding a balance, and it just seems like we live in a world where, and we'll get to this in a second, where the most extreme policy idea is what rises to the top. But from the tax perspective, you're not out here saying 0% income tax.
No, I think it's you create more of a challenge for yourself. And if it's purely consumption-based tax framework, what happens when consumption goes down dramatically? So, in the same way I used to advise clients on well-rounded business strategies, we wanted a well-rounded business strategy for our tax environment, and we got it. You should always have downward pressure on product. You don't want to tax productivity too much. But having that in the mix with consumption sales taxes is the right formula. I think it's indisputable. North Carolina's done well since we implemented those foundational reforms back in 2011. 2013, because I did not want to do tax reform in the midst of a financial crisis. What I wanted to do was reg reform to create the economic activity to then fund the tax reform. We were not in a position to do tax reform in my first 2 years as Speaker, but we got well positioned 2 years later.
Which I imagine included batting down some of your your members who were more extreme, like we're here, we're in charge, we got the gavel, let's go hard charging. How do you pacify? Because I think this is so incredibly important in this moment. How do you pacify the extremes?
I'm not very good at pacifying adults, to be quite honest with you. The way I pacified members in the State House, I created a committee on when we came in. We were all about jobs, jobs, jobs. I said, don't come to my office with anything that's not going to create or save a job. That's our first priority. We're in the middle of a financial crisis, and invariably, I hear what you're saying, but I need this or I need that. I got so tired of seeing some of these silly bills being filed. As Speaker, I can't stop a bill from being filed. I can just stop it from being moved. And in the past, you do serial referrals. So it'd be a dumb bill, and they'd say, you'd refer it to rules. If favorable, refer it to finance. If favorable, refer it to state government. If favorable, refer it to rules. That was a way of saying it's never going to be heard. I created a very concise way of saying it wasn't going to be heard. We created a committee on Ways and Means that never met. And when you got a bill referred to Ways and Means, it's because I would tell them there ain't no way and you got no means. You've just got to be disciplined. But when you get I was the second Republican Speaker since the Civil War. We made a lot of promises, and I was obsessed with fulfilling every single one of them. And I was damned if I was going to let anybody take us off that strategy. And we didn't. And we did well.
Yeah, and the state returned you then and said, okay, you've done so well at the state level, go fix what's going on in Washington. You mentioned a formula a little earlier, and I want to get your sense. You oversee intellectual property for the Senate. Yeah. We'll flash up on the screen the big fancy chairman title of the subcommittee. But, IP, when we talk about the formula for life science investing, IP is critically important. You're pushing some changes to intellectual property. Curious why something as weedy as IP, why does it make your radar?
I think IP is sexy. And I have to explain why. My first professional job, I came out of a warehouse. I was working for an insurance company in Chattanooga, Tennessee. Then I was recruited to Wang Laboratories in Boston, which at the time was $2 billion market cap, emerging technology, the hands down winner in office automation. But I was a product manager, and I'd have a lot of smart engineers and software engineers, hardware engineers come to me with good ideas. One of the first things I'd have to look at is this patentable, or am I going to get a recovery on my investment that I'm going to have to make? Because not all R&D pans out. So that gave me, at the ripe age of 25 up in Boston, Mass, gave me an appreciation for intellectual property. Who knew then I'd be in the Senate, and I'd had a chief who was formerly on judiciary said, I think we need to reinitiate the intellectual property subcommittee. Our office proposed recreating that subcommittee in judiciary, and I'm glad we did. We've done some extraordinary work, but quite frankly, it's the only reason I'm willing to remain on judiciary, because it is a real nuts and bolts, nitty-gritty, get stuff done committee. And we've got more to do. The PARA, the Patent Eligibility Restoration Act, is critically important for the life sciences space, because there are inventions, creations in life sciences today that are not even eligible for consideration to be patented. There's still going to have to be a process that you have to go through to receive a patent, but not even for consideration. And that will have, it already is having, a dampening effect on innovation.
Yeah, from our perspective, money can't chase the idea of something. It's the patent that makes the magic happen. We've gotten staying on IP, the administration, a lot of ideas, a lot of things come out. One that we sort of keep hearing about out of the Secretary of Commerce, and maybe more broadly, IP that is somehow derived from the federal space, therefore we get equity stakes in these companies. I hate
it.
Okay.
I think that is nonsense. I am tired of Republicans calling themselves conservatives if they condone that sort of intervention. With all due respect to the Secretary of Commerce, go back to business if you want to do that. That is not the proper role of the government at all, certainly not the federal government. Other than that, I don't have an opinion.
I was going to say, I don't even need a follow-up question.
No, it's absurd. It's sort of like it's going into these 10% stakes and chip manufacturers. Does anybody honestly believe that any other board vote matters when the U.S. government has a 10% stake in a major corporation? We've got to get out of that. Well, let the government observe and facilitate innovation, not become a part of it, because government does not innovate. It only creates the groundwork for innovation.
Well, and we seem to have a deepening reach by this administration. I think when you decided to come to Washington, the parties were beginning to meander from true pillars, and for Republicans, that was free markets and capitalism. We have meandered quite a bit. And now one of the issues that we talk a lot about here is this most favored nation approach, this idea of reference pricing, that the U.S. market should begin to employ price controls a la Europe, a la Japan. One, what do you think about that? Two, if we become a price-controlled market, where do you see consequences for the innovation jobs, North Carolina economy?
I think that it will probably lead to significant unintended consequences. Anytime you try to control the market or control prices, it never works. Never works. Now, one of the things that we should do is educate our consumers on one of the reasons why we are a very expensive jurisdiction. Take a look at our litigation environment. Take a look at I do believe that there is a disparity, and I do believe that there are certain countries that are getting an advantage that we need to equalize in the same way that we have trade deficits and we need to have more, I think, fair flow of trade. But against all of the blanket tariffs, I think the what, if we're trying to address the inequities in trade, I'm on board with. The how, I'm not so on board with. The same thing here. The what, I get it. There should not be there should not be a scenario where somebody's getting mail order RXs from some other country for consumption here, whether they're doing that legally or illegally, it's occurring. There's got to be a way to adjust for that. This is not the right way to adjust for it. It's mechanical, it's government enforced, and it's going to produce unintended consequences.
And so when you see these, I mean, let's separate the two issues because I want to hear this right. Company decides it's in their interest from a market-based solution to make some announcement on individual products that they're going to charge the same around the world. So company decided this is in our interest. Mm-hmm. That, in my mind, seems passable. So what the White House is sort of calling these MFN deals, they're really just company by company working with the White House, fine. The codification of these price controls, in my mind, is a separate bucket and one that needs to be pushed back with your colleagues.
Yeah. I don't think it has a prayer being passed in Congress. So I think this is an administration policy. But even the administration policy needs to be careful. I mean, when you're the U.S. government, you are the 1,000-pound gorilla. And of course, every company is going to come to some agreement. They may negotiate tough, but at the end of the day, they're not going to walk away from the table. So it's not a fair fight. So the question you have to ask yourself is what project is not going to get initiated? What drug is not going to be ever brought to market? It won't. The good news is it's going to be very low cost. The bad news is it's not going to exist. So I think it's striking that balance that I'm really trying to encourage in this administration. Now, the flip side, if you want to see what happens when you overreach, just go back to the Inflation Reduction Act. Mm-hmm. We have notes from board meetings where there were 60% cuts in small molecule research within months of the Inflation Reduction Act because of the blunt force object that they used to try and get drug prices under control. I mean, what more evidence do we need? Does anybody really believe that you want to go on, a CEO wants to go on into a board meeting and saying, we have slashed research and development for small molecule research by 60%? Not because we don't think there are incredible therapies and cures, but because the money's got to come from somewhere.
Well, this has been as an advocate sitting with policy, I mean, this one has been basic 101, as easy as it gets for me to explain a policy. We launched the life science tracker to show exactly that. The public statements from these companies saying, science is great, our people are great, I'm killing it because how can I justify pursuing a project that I know has 50% less revenue out of the gate? One of our VCs was quick to say, don't even pitch us an NDA-based product. You either reformulate as a biologic because the market's still there for that. So the EPIC Act, and for those who follow Incubate, you know the EPIC Act. This is one of our champions.
That's seriously geeky, by the way.
I know. This is who you're talking to.
You got like T-shirts and stuff?
You know, our head of public affairs, Grace, was running me through some recent numbers. One of our episodes crossed the 150,000 view mark. And I sat there saying, who are these people who are so keen to...
I did say IP was sexy. So
exactly.
I'm with you.
I know
I'd like to get a T-shirt.
Your IP is sexy, in quotes, with the logo. We can do that. Something that also comes up, something with the EPIC Act. So I'll sit with policymakers, both sides of the aisle. I'll explain to them the issue, and they get really defensive of small biotechs. And they say, you're right, I love small biotech. We'll put carve-outs in the bill for them. But it's this cognitive dissonance that the small biotechs and the investors behind them someday want to sell. And so the biotechs, the crown jewels of RTP, the Pearl, now here in Charlotte, pretty happy about it. Someday they want to be a product of a large company. How do you run into your colleagues this idea of big pharma bad, small biotech great? And how do we close the gap there?
I think it's as silly as big banks bad, small banks great. You need an ecosystem in these markets. And the ecosystem in finance and banking is no different than pharmaceuticals. You start small, you have a great idea, you get VC interested, you move it to the next level, you either grow big yourself or you become a part of something already established. Rinse and repeat. That's a healthy ecosystem in a tech sector that I focus on a lot in North Carolina. Picking winners and losers doesn't make sense to me. Government's horrible at picking winners and losers. And they in the process, they absolutely destroy innovation and risk-taking, dramatically reduce investments that we need to make to continue to be the envy of the world. We are the world's envy for the innovation economy. Everything that I do is with a focus on being able to say that for the next century.
So let's talk about the biggest threat to being able to say that for the next century. We just put out a stoplight. Green lights in China for life science innovation. Yellow lights, red lights here. Price controls, debates about IP, cutting FDA, NIH staff, however you want to look at it. We're not giving innovators here a massive green light. How does China factor into your view in the world now that the idea that they're just Me Too copiers seems to be fading and people are wising up? There's real science there. There's real investment there. How do we keep that at bay, not by building walls around China, but propping up?
We can be. Our society, their closed society only lets them innovate to a certain extent. And then when they can't, then they steal our intellectual property and move on from there. We have to get out of the way. We have to understand the FDA is the gold standard for bringing a drug or a therapy to market. We have to realize that we impose. It's amazing to me that we can impose so many kinds of requirements on our industry and still compete at any level. Imagine what we could do if we right-size the regulations, streamline the regulations with an eye towards eliminating every barrier where China has an artificial advantage. And there's a lot out there. There are some that we're just going to, the clinical trials, the sorts of things we do from the promising molecule to a new drug application to investigational new drug to clinical trials to bringing something to market. We're going to continue to maintain our position as having the gold standard. But we should remove every piece of fat and every unnecessary regulation, every checkpoint along the way, so that we don't have the pacing threat of China. And we do have a pacing threat. They are innovating now. AI takes that to another level. They're not as creative of a culture as we are, but AI kind of even normalizes some of that.
It will be a space to watch. I feel like one of the reasons we have barriers, I mean, you lay it out so clearly. Hey, barrier here, get it out of the way. That's why North Carolina was great. That's why the U.S. can be great. One of the reasons I think people don't rush to remove barriers is they don't believe in this industry. And how do we – I've got you here. I got two more questions. How do we change the narrative about this industry so your peers are saying, what can we do to champion this thing that we're so damn good at? That's not the narrative I get when I walk into an office in Washington. I get a go sit in the corner a little bit.
Yeah.
How do we change this?
I don't know.
narrative?
It really blows my mind because some of this is just cheap shot politics, right? It's vogue to attack pharmaceutical companies. You know, they're all a bunch of rich, charging too much money. It's easy to create a promising new drug, and there's no risk in getting it wrong. You know, it's just absurd to me how simple-minded people are in looking into this industry. But I think a part of what we have to do is probably do a better job, and I keep on emphasizing the value chain for healthcare. What we end up doing right now, you know, the good news for the pharmaceutical companies is right now the healthcare debate is everybody's flogging the insurance companies. They'll get back to you. They're in banking because you're all big and you're bad. But I think we need to do a better job of explaining just how transformational our life science industry has been to the world and how many untold billions of lives, have been saved through American innovation. Number one, we've all got to tell a better story. Y'all do, the industry does a pretty good job, but you got to keep forcing it. But I think the underlying frustration is why does it keep on costing so much when I get sick? And instead of this simplistic, insurance companies are to blame, pharmaceutical companies are to blame, PBMs are to blame, hospitals are to blame. Understand, even those industries are the gold standard. I don't know why we keep flogging the envy of the world versus saying, how do we get these gears working better and figure out how to maintain or have a downward trend on the underlying cost of healthcare? What I've tried to tell everybody wants to go in and give life sciences a haircut or insurance companies a haircut. I said, the problem is you're all wanting to shave their heads. Let's get them all in the barbershop and give them all a nice trim. There's clearly money to be saved there. In exchange for being able to reduce cost, one of the key things that you can do to reduce the out year cost of anything is to provide that industry some level of certainty. Otherwise, they're constantly reserving for the risk, and that is the root cause for some of the increases in healthcare.
That last point there, I've struggled to come up with a better term of there has to be fat in the system. And let me tell you, going into a progressive's office saying,
yeah, don't do that.
There's got to be fat in the system. But I think you're absolutely right that
it's margin. If you don't have look, going back to me being an R&D manager, I only had so much budget that I could deploy to research and development. I had to manufacture, I had to market, had to do all the other things to bring a product to market. And I just think it's being smart and reserving. And recognizing when you have a narrative in Congress about a shoe about to drop, you got to reserve for that risk.
Yeah.
If you have an impending tax that's about to come in, an MFN negotiation with the U.S. the administration, you got to reserve for the risk. At the end of the day, you have a responsibility to your investors, a fiduciary responsibility to your shareholders, to reserve for that risk. And that the money's got to come from somewhere. And if you can't provide a longer term runway for certainty, that's what you're going to get, a premium for what you're receiving today.
That is as well put as we've had it on the podcast. I cannot have Senator Thom Tillis on a podcast in 2025 without closing on something that has nothing to do with life sciences. Maybe, I don't know, you tell me. You have announced you're not going to seek reelection in the Senate. You are one of the big thinkers in United States politics and policy. What is next for Thom Tillis?
I'm going to keep innovating. I'm going to, I'm going to go back into business. I don't know. I'll focus. I like to scratch the itch. I think I've finally concluded that I can't really do what I'd love to have in my portfolio, some sort of really complex, nitty-gritty business turnaround, something like that. Probably maybe at the age of 65 need to realize I can't put all my eggs in one basket, but I love business turnaround work. I love taking a promising company to the next level, doing that kind of stuff like I did as a partner at Price Waterhouse. But probably focus a little bit on life sciences. It's important to me. Banking, financial services. I got to find a home, but I've got 398 days to do this job before I got to focus on that.
Yeah, you're walking around with a calendar floating behind your head.
Well, it's actually a widget on my home page on my phone, but
just first thing you get to see.
But you know what? I tell everybody I'm a project guy. I am not counting the days until I leave the Senate. I am mindful of the number of project days I have left to get things done, to get PARA done, to maybe get Prevail done.
Yeah.
There are a lot of legislative outcomes that I am optimistic that if I remain focused and I'm mindful of the amount of time I have left, that I'm going to get done. Then I'll go figure out what to do at the ripe age of 66.
PARA, Prevail, Epic, no price controls codified. You do that, you know.
That's just one committee. I'm on 4.
I am incredibly grateful. We got to get you up to Washington so you can close out the year. Thank you, Senator Thom Tillis, for taking time to be with us today.
Thank you.
That's it for another episode of the Making Medicine podcast. Thank you to Senator Thom Tillis for taking time out of his way, heading up to Washington to get to work on so many of the issues we talked about here. As the year begins to wind down, I also want to say thank you to the incredible team at Incubate, without whom the Making Medicine podcast would not be possible. Our head of public affairs, Grace Moster, as well as our policy director, John Guy. We also have an incredible production team based here in Charlotte, North Carolina, that makes all these episodes possible. Given all the great information and even a little pot stirring that Senator Tillis did on today's episode, it only seems fitting to give him the closing lines of Making Medicine. As always,
keep innovating.